Any one of you know how to measure blood pressure?
पूर्ण वैसे
Huh?
पूर्ण वैसे नहीं है।
Achha. What is the basic reason for that there is blood pressure? Whenever the heart is not pumping also, whenever there is diastole, all of you know, diastole is the part of the cardiac cycle when the heart is getting filled. So basically in that case, the heart is not pumping, but even then there is some pressure in the blood, in the arteries. So why is this pressure generated? Why is this pressure there during the diastole also? What creates the pressure? Anyone can answer? The main reason is that our cardiovascular system, it is having our heart, arteries, veins. There is a system, there is circulation. But this circulation is, whatever the circulation is capable of carrying the amount of blood, more blood is there, then what is the capability? लाइक जैसे मान लो एक पाइप है, बहुत बड़ा सिस्टम का पाइप है, उसमें तुम मतलब उतना ज़्यादा ये डाल रहे हो, उसमें वाटर या ब्लड जो भी हो, उसमें जितना वॉल्यूम है, जितना उसका कैपेसिटी है, उससे ज़्यादा तुम ब्लड दे रहे हो उसको अंदर या वाटर दे रहे हो, तो ऑब्वियसली पाइप में हमेशा कोई प्रेशर, कहीं ना कहीं तो प्रेशर बना रहेगा ना। तुम इतना सा पाइप है, उसमें बहुत ज़्यादा ब्लड दे रहे हो या वाटर दे रहे हो, तो दैट इज़ द मेन रीज़न, बट इज़ द बेसिक रीज़न व्हाई देयर इज़ ब्लड प्रेशर. So what are the ways? And another thing is that one thing is systolic pressure and diastolic pressure. So what is systolic pressure? Which part? When the left ventricle of our heart gets contracted, that creates the systolic blood pressure. And when the heart is receiving the blood, there is the diastolic pressure. That the pressure during that time is called the diastolic pressure. That is the diastolic pressure. So, how do you measure the systolic pressure of the heart? What are the methods? Can anyone tell me what are the different methods how you can measure the blood pressure of a person? There are three ways. One is palpatory, one is auscultatory, and one is oscillatory. Oscillatory method was used earlier, and nowadays oscillatory method is not used. And this what we are talking is actually indirect measurement of blood pressure. There is also a direct measurement of blood pressure. So what is direct measurement? Direct measurement is like we are connecting a cannula or the intravenous catheter or a syringe, whatever, a syringe or a cannula or whatever you can say. A cannula we are inserting into the blood. That blood will obviously generate a pressure on the cannula because we have inserted the needle there. That blood will create a pressure. So that is called direct measurement of blood pressure. But actually that is not done nowadays. In earlier days it was done, and in ICU settings today, in ICUs this thing is done, and in animal laboratories for the research purposes, this is used on animals. So this direct form of blood pressure measurement is not used nowadays. Nowadays, what do you use? Indirect method of blood pressure. What I have told you right now: palpatory, oscillatory, auscultatory. Then, what is the principle? What is the main principle? Do you know what is the main principle behind this? What is the mechanism that we are measuring the blood pressure with this instrument? What is the mechanism? Normally, the blood flow is laminar. Laminar flow means like there is a pipe and you are putting oil inside it. So, do you feel any sound or anything inside whenever the oil is passing through the pipe or something, or any dense fluid is passing through it? You will not listen to any sound, because this flow is laminar. Laminar means it is going along with the walls. There is no turbulence inside it. So, we normally don't hear any sound. So normally the blood flow is laminar. In measurement of blood pressure, what do? We create an artificial, we create an artificial pressure into our arteries, so that we are putting such an amount of pressure, so that whatever pressure the heart is producing on the arteries, we put an equal and opposite amount of pressure, so that the blood flow is stopped. So we will take the cuff like this, and we will. What is the method I'm telling? Now, this is the cubital fossa. And one thing is there, whenever you are measuring blood pressure, it is best if your arm is sleeveless. If you are having sleeveless or your sleeve is up to this much. And if you are wearing a full shirt or a full dress, then you should not roll the sleeves up. It should be like this only. If there is double layer clothing, then you should remove one layer. And if there is single layer and it is not possible to remove this layer, then keep it as it is. We don't need to fold up. If you fold this up, then you will create a tourniquet, and that will impact the blood pressure, whatever you are getting. So how you will record the blood pressure? We will put the, what is this? This is called inflatable rubber bag. This is like a balloon. This will, if we pump it like this, this thing will inflate. As you can see, this thing is getting inflated. So this is this inflatable rubber bag, and this is the valve by which you can control the air inside this. If you release it, this, then the air inside the valve will get out. So how will you check the BP? Like this. This is the cubital fossa, as all of you know. We will put this cuff 3 centimeter above, around 2.5 to 3 centimeter above this cubital fossa, like this. So this distance should be around 3 centimeter. So here we are putting the cuff like this. Someone volunteer? Volunteer. स्लिप को फोल्ड नहीं करना. Whenever you are measuring blood pressure, you should make sure the subject is either sitting or lying down. In normal circumstances, these are the ways how you measure the blood pressure. Sitting is the most common position, because normally whenever you are sitting in OPD, patients will sit only. There are also not such ways to make the patient lie down. And in hospital settings, if the patient is very ill, if the patient is not able to sit, then only we see in supine position. So these are the two methods, and the preferred one is by sitting. It's the most common method, by sitting. And one thing you have to keep in mind, that whatever we have taught in pulse class, that whenever a patient is coming to you, you have to allow the patient to relax for 5 minutes, so that he is physically and mentally both relaxed. Otherwise, you will get a wrong measurement, you will get a wrong BP. So that patient has to be relaxed. And one thing is, they are called white coat hypertension. White coat hypertension means some patients, whenever they see a doctor, they will have some anxiety and they will have some distress like this. So to avoid this thing, at least you should communicate to the patient properly, and you should allow 5 minutes of rest to the patient. So how should we measure the BP? So whenever, this is a sphygmomanometer. This one is sphygmomanometer, and this one is mercury. This level, what you are seeing, this liquid thing, this is called mercury. And this one is the scale with which you will measure what is the pressure, what is the mm per hg. This is in mm per hg. Then this each marking, they signify 2 millimeter. The gap between each marking is around 2 millimeter. Not exactly 2 millimeter, but it is around 2 millimeter. So whenever you are the doctor and he is the subject in this case. So whenever the doctor or the performer of the measurement, baby measurement, he is sitting here, the level of this scale should be at the eyes. Should be at our eye level. Should be at the eye level, like this. Like whenever I am sitting here, it should be at such level. It is actually a little bit higher. It should be at this level ideally. But this table is not movable. That's why we are doing this. So whenever we are using this, it should be at such a level that we don't need to strain our eyes. It should not be very low. It shouldn't be very high. It should be at the eye level, so the examiner doesn't need to strain his eyes. So give your hand. क्या बोला मैं? इतने ज़्यादा किसको बोल रहा हूँ? So after 5 minutes of rest, you should allow the patient to keep his hand on the table, so that his hand is relaxed or his arm is relaxed. Now what is the way to measure the BP? Loose karo, tight karo. This is the cubital fossa. From this there is 3 centimeter, around 3 centimeter of gap like this. We will put the cuff in such a way that this tubing, this is below side of the tubing, should be around the brachial artery. It should cover the brachial artery. It should feel for the brachial artery first. Here we are getting the brachial artery. Then we will put it in such a way so that this tubing is facing at the anterolateral position. This is the anterior position, this is lateral position. Anterolateral means it will come this side. This is the anterolateral position. And first we are showing the palpatory method. We are showing the palpatory method. So we put it here. And there is one more thing, that whatever cuff we are using, that cuff has to be of a specific size. Like if we are measuring his BP with this cuff. We are measuring his BP with this cuff. Obviously, if a 2 years old child comes to us, we will not measure with this cuff. There has to be a definite length. So, what is the definite length for the cuff? It is recommended around 2.5 centimeter of length of the cuff. 2.5 centimeter of width of this cuff. Not of this cuff, of this inflatable rubber bag. The bag is inside this cloth. This is whole of this completes the cuff. There is bag which is inflatable. This is inside this cloth. So it is having around a width of 12 centimeter and a length of around 24 centimeter. So in infants or whoever is at below 1 year of age, if you see the BP, usually we don't see BP in such patients. But if due to any requirement, due to any disease, we need to see the BP. So in those cases, the cuff width has to be around 2.5 centimeter. It should be 2.5 centimeter. In below 4 years, it should be around 5 centimeter. Then below 8 years, it should be the width I am talking about. That's not the length. This width, it should be around 8 centimeter. And in adults, it is 12 centimeter. So this is a 12 centimeter cuff, cuff with 12 centimeter of width. So this is the how the measurement of the cuff is done. So how do you measure now? This is at the anterolateral position. Now what we will do? We will first check for the radial pulse. You know how to check for the radial pulse? So you will be checking for the radial pulse like this with your 3 fingers. So I can feel the radial pulse. Now I will tighten this valve. I will tighten this valve. And I will then press it. I will inflate the bag by pumping this. I will inflate it slowly so that up to such a level so that I don't feel the pulse anymore. So slowly and carefully I have to do this. So right now I cannot feel the pulse anymore. So at that point where I cannot feel the pulse anymore, from that point I will raise it around 30 to 40 more, 30 to 40 mmHg of more. Like suppose I am not getting his, I stopped getting his pulse at 90. Now I will lift it up to 120 or 130. Like 30 to 40 more I will raise. Whenever I am not getting his pulse, I will lift it to up to like 130. Now I will release the pressure slowly till I get the pulse. So I am getting his pulse around 80 or suppose maybe 90. So if I am getting at 90, so this is his systolic blood pressure. There is one disadvantage with this palpatory method, that we can only get the systolic blood pressure and not the diastolic blood pressure. So his systolic blood pressure is 90. Suppose I am getting at 90, so his systolic blood pressure is 90. So this is the way I will measure the blood pressure. Now you are getting it, how we measure and what is oscillatory, which is not used nowadays, it was earlier used. Oscillatory means, you have seen now, whenever his BP was at 90, you can see there is some oscillation in the mercury level. It is jumping, na? This is called oscillation. So whenever we were getting the first oscillation of this mercury, we used to say this as the systolic BP. But nowadays this is not used. But in electronic machines and in some kind of machines, this principle is used. This oscillatory principle is used. They are based on this principle. Now we will see the auscultatory method. So how we will see the auscultatory method? Actually, if we are seeing for our learning, whenever you are seeing a patient, how will you measure the BP? First, you will take one reading of the palpatory method. Then you will take 3 readings of the auscultatory method. One reading of this like this, and 3 readings like the stethoscope. Then the initial reading we will leave, and between each reading we have to take at least 2 minutes of gap so that the patient is relaxed. So we will take three readings of the auscultatory method, and in between 1, 2 and 3 we will take 2 and 3. The both readings we will take, and then we will take out the average. Like if we are getting 120 by 80, and in second reading we are getting 130 by 80, then we will take the average of 130 plus 120 by 2, then 80 plus 90, something whatever, like by 2. Then whatever we are getting, there is the BP. This is how we will take the BP. So how do you do the auscultatory method? दर्द हो रहा है अभी, मैं से क्यों कर रहा हूँ? नहीं तो बोलो चेंज कर देते, कोई और करेगा. तुम 80 में ऐसे ऐसे कर रहे हो, मर जा रहे हो तो ज़्यादा बड़ा होंगे तो कैसे करोगे? So how you do the auscultatory method? Auscultatory method is done like one thing. This cuff should be at the heart level. That's thing you have to make sure. And this also it should be at the heart level and the level of the examiner's eyes. So this is the heart level, na? Heart is nearly at this level. So this is coinciding. और ये थोड़ा और नीचे होना चाहिए था, इसलिए मैं बोल रहा था अगर थोड़ा और नीचे होता टेबल तो फिर ठीक था. ये थोड़ा ज़्यादा ऊपर है. दिस टेबल इज लिटिल बिट हायर, सो दिस हैज़ टू बी लाइक दिस मच. So how do check the auscultatory method? What BP we have got during the palpatory method? 90, na? So you will take that thing only. We will take that into consideration, and directly we will lift this up to 130. Whatever you got in the palpatory method, we will directly lift it up to 30 or 40 more. Like 130 also, 120 also you can lift. So directly I will put my stethoscope here. From there, I will bring it down slowly at a rate of around 2 millimeter per second. So I will bring it down slowly. So his BP is around 90 by 60. So his BP is around 90 by 60. So how will you get the BP? So whenever I already told you that from the palpatory method we will lift it up to 30 or 40 more. Then we will bring it down very slowly in a very controlled manner. Slowly we will bring it down. We will not rush. Otherwise we will miss the BP. So when it came at 90, I could hear a sound in this position. We will put the stethoscope in the medial side of the hand. How will check the medial side? This is the biceps tendon, na? From the biceps tendon, we will correlate. Like whenever I am telling you that the anterolateral side is this, then from the biceps tendon, we will take the anterolateral side. And from the biceps tendon only, we will take the medial side. This is in the middle. So I will put my stethoscope in the medial side, and preferably in the area where I am getting the brachial artery pulsation. We will check for the pulsation of the brachial artery. So I am getting it here, so I will put my stethoscope here. Then whenever I am able to listen to the brachial artery pulsation, that is my systolic BP. You are getting it, na? Whatever I am telling. Then whenever you are getting the first sound here, the beginning of the first sound, that is the systolic BP. However faint is the sound in that sound, that sound is systolic BP. And through the course of the lowering of this meniscus, the BP, the sounds will keep on changing. And at a certain point of time, like at 60 or at 70, you will be not getting any kind of sound. You will stop getting any sound. At the first moment when you will stop getting any kind of sound, that is your diastolic BP. You understand how to measure the BP? First, whenever I am taking the reading, like suppose I am like this. I put the stethoscope in my ears. Suppose that I put my stethoscope in my ears. Then I have raised it like this 130. For your revision I am repeating again, and then you will bring it down. Suppose I am getting not this fast but slowly, like I am getting this pulsation at 90, not pulsation, this I am listening to this sound, and also alternately you can put your hand also there. Then I am listening to this at 90, so I will keep lowering this slowly, and at a certain point of time, like at 60, after 60 I didn't get any sound. So this is the diastolic BP. Everything is clear for you? So like this I will take 3 readings, and the second and third I will make an average, and that is the actual BP of the patient. Systolic. And when the sound is disappearing, that is diastolic. So similarly we will take 3 readings, and you have to take the readings of both hands. ऐसा नहीं है कि हम एक ही हाथ का लेंगे, हो सकता है किसी का हाथ कटा हुआ हो, कोई इंजरी हो, कुछ हो. फॉर रेफरेंस बोलो, हो सकता है ना बर्न इंजरी का कोई आ सकता है, पेशेंट कोई आ रहा है उसका बर्न इंजरी इतना हो, तो उसका बीपी देखोगे उस टाइम छिल गया उसका स्किन, तो इन दैट केस ओनली सी वन हैंड. But if it is possible, in normal patients, we will see both hands. In both hands, which BP we will take? जैसे मान लो यहाँ से यहाँ का ज़्यादा आ रहा है, यहाँ इसमें ज़्यादा आ रहा है. Whichever hand is exhibiting more BP, that is our BP. That person's BP is that thing is the person's BP. Like if he is exhibiting an average of 110 by 80 in this arm, and he is getting, I am getting 130 by 90 in this arm, then 130 by 90 is this person's BP. Understood? In the similar way, 4 readings you have to take. 1 palpatory, 3 auscultatory. 1 palpatory, 3 auscultatory. Average, जिसमें ज़्यादा आ रहा है, that is our reading.